And good morning, Santa Clarita, and welcome to Aging with Power, sponsored by Comfort Keepers in Home Care. I am your host, Myles McNamara, and our show focuses on the challenges and the topics that we face on this journey that we call aging. We begin aging from the moment we take our first breath, and although our show will primarily focus on adult and senior issues, we will from time to time focus on the entire aging spectrum, from the womb to the tomb. And we're going to do that today, but I'll get to more of that later. Our subject matter experts will address concerns and questions to empower us to make informed decisions. Now, if you ever have a specific question, we are interactive. We are Facebook Live. So if you have a question during the show, our sound engineer, Cody. Hey, Cody, good morning. We'll keep an eye out for your question. Just go to KHTS Radio, and we are Facebook Live. So we'll wave and smile at you occasionally. But please, if you have something that comes up that you'd like us to address, please, we have a great show in store for you today. In the house, we will have UCLA Health. Starting the show with me, I've got Nikki Bonner, the Marketing and Community Outreach Coordinator, who has gathered an amazing group of doctors who will be joining us and talking about their specialties and the services that are available in Santa Clarita. Good morning, Nikki.
Good morning, Myles. Thank you so much for having us.
You bet. Thank you for all your efforts in wrangling these cats. Just kidding, docs. But also, to open the show, I'm going to step aside a minute from the typical host and be a shameless, proud dad. What you may or may not know is today is National Military Appreciation Month. And I mentioned earlier that we jump around the aging spectrum from time to time. And about 5 years ago, I had my daughter Maris on the show because she was taking her SATs and she was getting ready for college. And we just wanted to talk about the stress that high school students go through. Well, today I sit with my married, amazing daughter, who is a first lieutenant in the United States Air Force and about to become a captain in the United States Air Force. And in less than a week is going to be deployed to South Korea. Also in the house with her is her husband, Evan Glenn, who is also going to be a captain very soon in the United States Air Force and going to South Korea with them. Maris and Evan, welcome to Aging with Power.
Good morning.
Thank you.
Get a little closer to the microphone. So again, National Military Appreciation Month is not needed for Dad to be popping his buttons. I can't tell you how proud I am of Maris and, of course, Evan. We'll refer her to as Maris McNamara Glenn for today. So again, guys, you're here for a short stay before you head out to South Korea. So I just want you to real quickly say kind of what it is you do with the Air Force, what your job responsibility is going to be when you get to South Korea, and just kind of give us a little bit of a snippet of life in the military. So again, welcome. Hi, Maris.
Thanks. Hi, so I'm Maris, obviously. I'm an airfield operations officer in the Air Force. So what that means is, depending on the location, depending on the base and the mission of that base, we as airfield ops officers lead and are charged with caring for anywhere from 80 to 150 people, ranging from young military to senior military, civilians. And with that team, we are charged with maintaining a safe airfield environment. So we oversee air traffic control. So that's what you think of when you see the airport, the tower. And then when you see in movies, the radar screen with the moving green dots that we try not to touch, and always succeed, for the record. But so air traffic control, and then runway maintenance. So we make sure that the runway is safe and well maintained, that all the equipment that pilots use to land in bad weather are working properly, and we just create a really good environment for pilots to accomplish the mission. So that's what we do.
And you come from Dover, Delaware, is where you've been stationed for the last couple of years.
Yes.
Which is, I think, what was at the top of your list because that's where all of our servicemen and women who've been killed in action come back home to, right?
Yes, Dover has the privilege of being the port mortuary for the DoD. So anytime a service member is killed or passes away, regardless of location, they come to Dover first, and we afford them full military honors, and they do a military investigation, and it's really at the request of the families on how we honor them. It's really, really cool, and if anyone gets the opportunity to go to Dover, I think there are ways that you can request a tour through your congressman and just kind of see the awesome way that we get to honor our fallen service members.
Awesome. And Evan, real quick, you're a little different with logistics, with what your job responsibilities are going to be. Kind of give us a quick breakdown of what you're going to be doing in South Korea.
Yeah, so I am a logistics readiness officer. Basically, that entails overseeing the movement of supplies, equipment, materials for the Air Force and the DoD as a whole. So in Dover, it's a huge cargo hub for anything going overseas, to the Middle East especially. So a lot of the stuff that you'll see going on trucks or on trains, if you're on the road, that might be going to Dover to hop a ride on a jet. Over in Korea, I'll be doing something a little bit different. I'll kind of oversee some of the exercises that they have going on, just making sure that we're always fit to fight.
Nice. Well, and you guys are here with me until Friday, and then you do a quick layover in Seattle, and it's off to Korea you go.
It is. We're excited.
So, again, folks, May is National Military Appreciation Month. Not that we need a month to honor the folks that put themselves on the line for us every day. And I love you, Maris.
Love you, Dad.
All right, guys. Thanks so much. And, guys, we're going to take our first break. And when we come back, we're going to start the rotation of all the amazing doctors at UCLA Health that Nikki has gathered for us. You're listening to your hometown station on AM 1220 and 98.1 FM.
One more day, one more time.
We've been singing their songs for decades, and now Time in Rio brings their musical magic to the Santa Clarita Performing Arts Center on Saturday, June 30th.
What a beautiful mess I'm in, spending all my time.
KHTS is proud to present Diamond Rio, 6-time country vocal group of the year, 23 top 10 hits. Experience Grammy Award winners Diamond Rio like you've never seen them before, right here in our hometown at the Santa Clarita Performing Arts Center.
Imagine that, loving lasts forever. Imagine
Country legends Diamond Rio, and featuring our one and only local singing sensation, Savannah Burrows. Savannah Burrows and Diamond Rio, together at the Santa Clarita Performing Arts Center, Saturday, June 30th.
what a beautiful mess, what a beautiful
Tickets are going fast. Visit canyonspac.com to purchase yours. canyonspac.com for Diamond Rio.
The College of the Canyons Nursing Program will be hosting a BSN Information Night on May 9th from 6:30 to 8 p.m. in the Santa Clarita Performing Arts Center. Looking to get into the nursing field? Want to earn your Bachelor's of Science in Nursing? Representatives from various colleges will be outlining their BSN programs, and students will share their experiences. Pathways from concurrent enrollment and registered nurse to BSN programs will be covered. All are welcome. Visit canyons.edu/nursing for details.
If you are at least 55 years of age and have a torn and irreparable rotator cuff, you may be eligible for a no-cost clinical trial at Southern California Orthopedic Institute's Valencia Clinic. Call 818-901-6600, extension 1525, or visit rotatorcuffstudy.com to learn about a study of an investigational shoulder implant. Call 818-901-6600, extension 1525, or visit rotatorcuffstudy.com. Sponsored by Micro Air Surgical Instruments.
Santa Clarita's hometown station.
Now FM, 98.1 FM, and AM 1220, your hometown station.
Welcome back to Aging with Power, sponsored by Comfort Keepers in Home Care. I'm your host, Myles McNamara, and we are joined in studio today by a slew of very talented doctors providing an array of specialty services right here in the Santa Clarita Valley with UCLA Health. And before I introduce Dr. Nibet Sudin of hematology and oncology specialist, I'm going to, well, first of all, good morning, Dr. Sudin. Good morning. Don't want to be rude there, but I'm going to hand it over to Nikki Bonner real quick to talk about, as I said earlier, she's the marketing and community outreach coordinator. Kind of give us a quick little overview of UCLA Health and what we're going to hear today, Nikki.
Thank you, Miles. We are thrilled to be expanding the way we are in Santa Clarita. It's the community has made us feel very welcome, and it's a wonderful environment to be providing care in. We are now in 3 different locations. As many of you may have seen on Turney Road, we have a new building right opposite the Country Club. That's at 27235 Turney Road, and that is we've got an amazing radiology center in there, which we're going to hear more about this hour. Dr. Suden is also located there. Our hematology oncology practice is on Turney Road. Then over by the hospital, we're at 25775 McBean. There's a big sign on that yellow building. Many people know that building quite well, and that's often where people think our only location is. But no, we have a number of suites in that building, and then of course we are also over at 23861 McBean, which is also on the Henry Mayo campus, and we have a brand new obstetrics and gynecology suite that just opened a couple of weeks ago in that building, and you're going to hear from Dr. Collins a little later this hour, and she is our new OBGYN. We've really got now a full array of primary care and specialties in Santa Clarita. Just to give you a few, we've got internal medicine, we've got cardiology, cardiac imaging, colorectal surgery, dermatology, Mohs surgery, that's for skin cancer, and then we've got, digestive diseases, endocrinology, ear, nose, and throat, et cetera, et cetera. So we've got a lot of different specialties. You can get the full array on our website, which is uclahealth.org /Santa Clarita, and that's the best place to keep up with our expansion and see when our new doctors and our new specialties.
That's awesome. Well, let's jump right into it because I know we have an amazing lineup, and I don't want to cut into Dr. Studen's time here. Again, thank you for taking the time to come out of your busy schedule here. But let's talk a little bit about you and your hematology and oncology practice right here in Santa Clarita, Dr. Suden.
So, I practice hematology oncology. Oncology is cancer, so cancer treatment, diagnosis, etc. Hematology is blood disorders. So in our center, we see every type of cancer, breast cancer, colon cancer, prostate cancer, etc. We also treat blood disorders, so any anemias or blood counts that may be abnormal, clotting disorders, etc. So, we're in the community. We see anything under the sun as far as hematology and oncology goes. We have a beautiful new infusion center that has a great view of the golf course, and it's just amazing. But that's where patients get their intravenous medications, chemotherapy, etc.
Well, and I see Nikki did an amazing job for me, giving me some bullet points here, and I'm not familiar. What is integrative oncology?
So integrative oncology is basically a term that we use that combines, in a way, old and new, I guess. So new is all the newer medications, newer technology, all what medicine stands for, and then also taking into account the whole body. There's more than just medications that people need. So we use things like meditation, yoga, acupuncture, nutrition, counseling. It's a whole array of things to address not just the disease, but also the human being, the person. And that's really what that term stands for. It integrates all aspects of medicine.
And what have you seen and there's so much more attention being paid to that aspect of it, the whole package, so to speak. But what are the biggest breakthroughs that you're seeing and are excited about?
Well, so I look at it this way. There were things that your grandma used to tell you, when you were growing up, chicken soup and, just all this advice that she gave you, right? Different herbs and different things that, frankly, when I went through medical school, I was a little disappointed. They never talked about it, right? But there have been things that have been ongoing for thousands of years. So, if you go to India, there's Ayurvedic medicine. If you go to China, there's traditional Chinese medicine, including acupuncture, for example. We've been using these for thousands of years. What's great today is actually we're doing studies on this, and we're finding evidence that this stuff actually works and augments standard treatment. So I wouldn't go as far as saying it replaces standard treatment, but it definitely helps. It augments. There's studies that show, exercise, nutrition will actually improve outcomes in cancer, help prevent cancer, help fight cancer with treatment, and help prevent cancer from coming back after you've been treated. And that's again in addition to the modern technology of imaging and all the medications, et cetera. But it's amazing to see that it's finally happening.
And we can't forget Grandma's chicken soup.
Right. I mean, there's something there, right?
Right.
There's something there. Maybe we don't know what it is yet, but it's something there.
Well, and as far as addressing the whole body person, if you will, I mean, we also hear a lot about how stress and bad nutrition and lack of exercise can really activate those cancerous genes in cells, correct?
Right. So now there's studies coming out that show stress management can actually influence the chemistry in your body to actually help your immune system to fight cancer, to prevent cancer. Same thing with, nutrition, exercise. That's exactly what I was saying. There are actually studies that show exercise will lower the risk of cancer. I mean, and that's just amazing. And we're not talking running a marathon.
Right.
We're talking 20 minutes a day, 4 or 5 days a week.
And just eating well and maintaining the stress levels. Well, Dr. Student, I appreciate your time and coming out, and I know Nikki's going to give us all the contact information and how to get to you guys because of all the amazing services that you provide for us. So again, thank you for coming out today. And folks, we're going to take our next break. When we come back, we are going to be talking with Dr. Omar Sahagan, a Harvard medical graduate that's going to talk to us about radiologists and the other types of services and imaging that's available right here in Santa Clarita through UCLA Health. So don't go away. You're listening to Aging with Power on your hometown station, AM 1220 and 98.1 FM.
Why do people from all over Santa Clarita come to our spa in Canyon Country? Simple. They want the highest quality services at prices that everyone can afford. This is Rosemary from Beyond Harmony Med Spa. Read our reviews and know why we won the Ultimate Beauty Awards 2 years in a row by the readers of Elite magazine. Come and see how close we really are and experience the level of excellence that our clients have loved for the past 13 years. Go to beyondharmony.com or call 298-8008 today for a free consultation.
Your building sign is essential in getting customers to your location. Feathers can help get your business noticed. They walk you through each phase of your building sign project, providing special attention to detail and quality. Feathers will give you a sign you can be proud of. Your building sign will draw customers in instead of having them drive by. Feathers on Soledad in Canyon Country, across from the Edwards Theater. Or go to feathersphoto.com. That's feathersphoto.com.
The Santa Clarita Artists Association has a new gallery in downtown Newhall on 6th Street between Main and Railroad, right across from the Canyon Theater Guild. The gallery features our members' paintings, sculptures, and one-of-a-kind handcrafted gift items. Whether you're an art lover, buyer, or an artist wishing to join, visit our website at santaclaritaartist.org, come to our free monthly meetings at Barnes & Noble, or stop by the gallery. For upcoming events and exhibits, check us out at santaclaritaartist.org. We make visual art visible.
Santa Clarita's hometown station. Hometown station.
KHTS AM 1220 and the new 98.1 FM.
Welcome back, folks. You are listening to Aging with Power on your hometown station, AM 1220 and FM 98.1. I'm your host, Myles McNamara. And today we have in studio UCLA Health and the different array of services and things they provide for us right here in the Santa Clarita Valley, no longer having to jump over the hill. For this segment, we are going to be speaking with Dr. Omar Sahagan, who is a radiologist and imaging specialist, Harvard graduate. And, Dr. Sahagan, welcome to Aging with Power. I appreciate you coming out.
Thank you very much. Thanks for having me.
So let's start with the basics of what the heck is radiology and imaging all about, and how do you apply that specialty?
Yeah, so first, we're very happy that we are now offering radiology and imaging services here in Santa Clarita. It's been a long time coming. We have a center located on Cherney Road where we offer a full array of imaging services, including the basic services, which is bone density, X-ray, ultrasound, CT, PET, and MR. We are excited about some of the new imaging modalities that we brought out here and what we're doing to expand imaging services. One is lung cancer screening, which is relatively new. We see patients in consultation in our clinic, and we provide imaging services for these patients, and have a discussion with them afterwards, and of course notify their referring physicians about the imaging findings. We also have a women's center, and at the women's center, we offer a full array of imaging services for women, including screening and diagnostic services. We do 3D tomosynthesis, which is a great imaging technique. It boasts a higher detection rate and also results in fewer callbacks for our patients. We offer interventional.
Say that term again.
It's 3D tomography or 3D tomosynthesis.
Is that more for the mammograms?
It is. So it's breast screening, but it's mammography in which we use a different technology which allows us to see the entire breast in a 3D format instead of going through the breast and just in simple 2D standard views. And it really is a great imaging modality that allows us to really increase our detection rate for cancer and result in fewer callbacks in patients having to come back to the center.
I would assume renders the old way obsolete. I mean, you have this such a thorough.
Yeah, I think that in time it's an adopted imaging technique that most insurances now are starting to recognize that this is the way to go. And I do believe that in the next 12 to 24 months, it's going to become the standard.
It's amazing how insurance still dictates our care, but that's a whole different show. Yeah. All right, I'm sorry. Go on. I digress.
And outside of just diagnostic and screening mammography, we also offer interventional services. So if we do find something on one of these imaging studies, we provide biopsies under ultrasound, MR, or stereotactic guided technique. We offer super specialized services that, as you discussed, as you started off here, that were only previously offered at UCLA before. But now most patients can stay here in Santa Clarita without having to jump over the hill and sit there in traffic for an hour and a half driving over to the main campus. One of the things that we're really excited about is that we offer urological services, including MRI, prostate, and PSMA studies, which are studies designed in diagnosing, staging, and treating patients with prostate cancer. We offer those services here in Santa Clarita, and I believe we're probably the only center that does that now, and at least with the high-resolution magnets that we have. We have 2 3T magnets in our center. Most magnets out in this valley are of a lower field strength, and that we offer for the prostate MR. In the old days, they would do these with endorectal coils, which were really uncomfortable for patients. The way we're doing them now is this high-resolution coil that just wraps around the patient's pelvis, gives us really, really high-resolution imaging. And the great thing about all this is that all of our reads at UCLA are performed by subspecialty expertise. So you will never get a study read by someone who's not an expert in their field. And a lot of the people at UCLA are really nationally recognized in what they do.
So you had mentioned some of the screenings, what early detection, obviously, and that what you'd mentioned lung cancer screening. What are the types of things that we should ask our doctors to be proactive, and the types of screenings we should ask for to make sure everything's okay? I mean, other than the lung cancer screening and the mammograms that ladies are recommended to do annually, I believe, or biannually, what other types of screening should I, as a person looking out for my health, be asking my doctor about?
Yeah. In medicine nowadays, we have a certain criteria that's set for most cancers. So, if you're a patient dealing with, if you're a female and you reach a certain age, then it's recommended that you get breast studies, imaging studies. And the great thing about medicine nowadays is that technology has really, really taken off. There's so much that we can do in imaging nowadays that wasn't available before. That really is a helpful tool for clinicians referring patients. In the old days, they may rely more on clinical markers. Nowadays, imaging is very, very helpful. The example that I gave you was 3D tomosynthesis.
Right.
Prostate MR, they were using clinical biomarkers for that as well, which is your PSA, your antigen. Nowadays, we can detect the smallest lesions using prostate MR. So the important thing is to talk to your physician, find out what you may be at risk for based on your past medical history, based on your age, and find out what you should be screened for and make sure that you follow up. And most of these studies we offer here, just in our backyard.
Well, in closing, I mean, what do you see that's, the advances and stuff that you're most excited about and what's coming down the road? I mean, like you said, exponentially advancements in technology. What do you see coming down that really puts hitching your giddy up?
Yeah, interventional services. We have an interventional suite here in Santa Clarita. We have interventional radiologists who are coming down, seeing patients in consultation in our center, and treating patients for a wide array of diseases, including artery and vein treatments, patients with peripheral arterial disease, patients with deep venous thrombosis or clots in their legs, patients with varicose who need varicose treatments. We are doing a lot of oncologic treatment as well, so many invasive procedures and treating patients with a variety of cancers, including lung, liver, and prostate. We are currently seeing patients in consultation at our clinic now, are performing some of these procedures as of today. Most of these procedures, I do see that we're going to do these in a safe manner in an outpatient center real soon. Of course, some of the higher risk patients will still need to be treated at the main campus in Westwood, but we can definitely see them in consultation here.
That's awesome stuff. And again, the advancements of what's going on right here in our little old hometown of Santa Clarita. It's amazing stuff. We're Dr. Hagen. I appreciate you taking the time coming out today. We are going to take our next break. And after the break, we're coming back with Dr. Anna Skay, who's going to talk to us about some of the specialties that she does, including digestive diseases. And rumor has it she's actually a UCLA Bruin and a USC Trojan. How the heck did she do that? But anyway, we'll find out after the break.
Santa Clarita Water has a long history of safe, reliable water service. SCV Water is dedicated to increasing efficiencies, protecting our vital resources, and improving their customers' experiences. That's you. Meet them at their new home on the web at yourscvwater.com. There you can find the latest news, rebates, and much more. That's yourscvwater.com. They can't wait to serve you.
Strawberry lovers unite at the 35th Anniversary California Strawberry Festival, May 19th and 20th in Oxnard. Ever tried a strawberry pizza or strawberry beer? Join the celebration on our expanded grounds with 50 food booths, concerts, rides, arts and crafts, and more. Admission is just $12 for adults and $5 for kids, with proceeds benefiting local charities. Get tickets now at castrawberryfestival.org to the California Strawberry Festival, May 19th and 20th.
Start your finish at College of the Canyons with over 700 low-cost summer classes. They have quick 5- and 8-week on-campus sessions. Don't have time to come to class? Online class options make it convenient for you to take classes on your own computer. Incoming high school juniors and seniors, you can take classes too. Take advantage of convenient summer sessions beginning June 4th, June 11th, June 18th, and July 9th. Visit canyons.edu/class schedule now.
Do you like to rock across Africa?
Then the wait is over.
Africa Rocks! Africa's Greatest Hits is now available at the San Diego Zoo! And who could forget 99 red baboons?
Or the African crested porcupine smash hit, I Got Quills to Pay the Bills! Hey, don't get too close!
And the hits keep on coming!
Africa Rocks has all your favorites from 6 different African habitats.
Hungry like a leopard.
Ibex is back.
Harder, better, Fossa stronger.
And a new track from Kendrick Lamar.
Now, Larry.
Yes, Chuck?
A collection of this magnitude, I'd fly to Africa.
Well, don't pack your bags, friend. Africa Rocks is only available right here at the San Diego Zoo.
Wow, that really does rock.
No, it Africa Rocks.
Welcome to Africa Rocks. Experience 6 different African habitats, including our first ever aquatic enclosure with African penguins. Only at the San Diego Zoo.
Your hometown station.
KHTS AM 1220 and the new 98.1 FM.
Welcome back, folks. You are listening to Aging with Power on UCLA Health Day. We have a great lineup of doctors and the specialties provided right here in the Santa Clarita Valley with UCLA Health. And joining me right now is Dr. Anna Skay. And, the Hatfields and McCoys had a feud that went way back. And how'd they settle that? They married off a McCoy to a Hatfield. And I'm looking here, Dr. Skay, that says you did kind of the same thing with the UCLA Bruins and the USC Trojans. You're both a Bruin and a Trojan?
Absolutely. I didn't just marry it away. I took two and I made something better. So let's see what happens with that.
Awesome. Well, welcome to Aging with Power, Dr. Skay. And so your specialty is digestive diseases.
Yes.
So let's elaborate a little bit on that.
So basically, fancier words for gastroenterology. Guts and butts, if you want to go there. But we do everything that you feel from the mouth to the exit, but as well as liver disease, pancreatic disease. Sometimes people forget that that's also part of the digestive diseases purview. And we basically see everything and anything that lies either within the GI tract, or people have symptoms that feel like they're within the GI tract. So that'll include anything from, if you're talking about up top, difficulty swallowing or reflux, are you having heartburn, and then you keep going down, do you have any kind of abdominal pain, and then you keep going down, and now we're talking about constipation, diarrhea, and everything that people don't want to talk about, even with their doctor. And so, but we also take care of a lot of liver disease, chronic, as well as something that comes on suddenly, as well as pancreatic disease, which can be very painful and to the patients.
Kind of a double-sided question. What's the most common thing you treat, and what's the most common thing that's sort of like not the case when folks come in concerned about something with you?
Well, the most common thing, probably, I would have to split it 50-50 between a heartburn, GERD kind of picture, as well as problems with bowel movements. And those I would go probably 60-40 constipation to diarrhea. And obviously the scariest thing when people come in is it cancer? I would say most of the time it is never cancer. But obviously, that's the first thing we have to rule out, is anything that a patient is scared that they have, or anything we can think of that we don't want them to have. But most commonly, we do have a few things that we see on a daily basis.
And it's kind of scary to think that a lot of folks miss the window of early detection because they don't go to the doctor because they don't want the bad news.
Which is terrible. Most of the ones who actually do come on time, you start, for an average person with a very low risk of having cancer, still got to come at 50, even 51, you're tardy to the party, and you got to start the screen because it's better to find a polyp than a cancer. And people aren't so afraid of polyps, which is good, but polyps are what make cancer, so you got to be on time.
So what are the things that we can do as far, you and I don't know if this fits into your lane as far as these diets with gluten-free and the low carb, slow fat, high, I always believe in, everything in moderation is fine. That's my justification. But there is such a movement out there that you're seeing possibly as well with the gluten-free or the reactions and allergies to gluten, and and then obviously the segue into how often should we do the proactive stuffs like colonoscopies and the things that we needed to be, staying out in front of. But what are you seeing as far as the digestive issues with folks and the gluten and the other diets and, cutting, you need good fats. You can't cut out all the fats. So what are you seeing as a kind of a common denominator there?
The common denominator, I would say, is people think that cutting out the fat is the good way to diet, and actually research is reversing that a little bit, and actually sugars are what's causing the heart disease later on. So good fats are always good for you. And the gluten-free diet, that's been sexy for the last decade. It's Los Angeles, it's Hollywood. And I would say there are people who absolutely have to be 100% gluten-free, and that's called celiac disease. That's diagnosed on endoscopy and labs. And then some people do feel better by cutting out gluten, and that's a lot of irritable bowel. And we do see a lot of patients with irritable bowel. And part of their symptom management is what they eat. And we work with a lot of nutritionists who are excellent at this to avoid pain, bloating, and any kind of changes in bowel habits.
And speaking of bowel habits, I mean, a lot of our seniors, especially, they start to not be as regular as they used to be. What do you see the main cause for that? I mean, 'cause to me, aging is not a diagnosis. You're getting old. I hate that. So what do you see the cause a lot of times in most normal people as far as, day-to-day ages versus our seniors as far as the regularity, the constipation, the bowel movement issues? What do you see there as far as the common denominator?
Absolutely. I mean, that's an excellent thought because that's what people really fear. For women, unfortunately, it's the hormones. Menopause hits, you can cut your bowel movements in half, and you really have to stay on top of a high fiber diet because high fiber will keep things moving. But really, if you combine men and women, maybe you're getting a little less active. Sometimes the intestines just don't move as well. But a high fiber diet, if you start that 30s and 40s, that'll keep you going all the way.
Well, I'm noticing too in the area of TMI, the more I exercise, the more regular I am. So, I mean, I think a lot of times as our seniors slow down and they're not exercising the way they used to, I think that really goes hand in hand, no?
100%.
Okay, and then as far as our early detection, like I mentioned earlier, the colonoscopy. Everyone always loves to talk about colonoscopies. What's the risk? How often should someone do it? Is it a genetic thing? What should we do on the colonoscopy level?
So, unfortunately for patients who have cancer running in their family, it's much easier. You got to start them at 40. But for those who don't have a family history, they should really start no later than 50. There are risks involved. You get sedated. It can alter your vital signs, but we watch you very carefully. There's risk of a perforation and bleeding, which are very low.
Very rare.
And very rare. But really, the risk of not doing your colonoscopy is missing a cancer. And then you're talking about chemotherapy surgery if you survive it. So that's the risk and benefit ratio of a colonoscopy. And I would say the colonoscopy is still the best screening method we've got.
And I got to say, being a veteran of many of them, it's the prep day. It's not the event.
I got some pointers if anyone ever needs any,
well,
how
Dr.
to survive
Skay,
that.
I appreciate you coming out and sharing your wisdom with us. And Nikki's going to wrap it up for us toward the end of the show with contact information and how to get to you. So, again, thank you for coming out to Aging with Power.
Thank you for having me.
All right, folks, we're going to take our next break. And when we come back, we are going to be chatting with Dr. Jacqueline Collins, a gynecologist and obstetrician. So don't go away. You are listening to Aging with Power on your hometown station, AM 1220 and FM 98.1.
What's the perfect way to end the weekend? Sunday brunch at Salt Creek Grill, of course. Wind down with delectable dishes off Salt Creek's award-winning menu and enjoy a glass of champagne, because after all, you deserve it. Make Sunday brunch at Salt Creek Grill a new tradition with your family and friends. Salt Creek Grill in Valencia on Town Center Drive in front of the movie theater. For reservations, 222-9999 or go online to saltcreekgrill.com.
Mission Valley Bank is a commercial bank in the Santa Clarita Valley that really puts the community into community banking.
At Mission Valley Bank, we strive to be a trusted advisor to our clients, and that means being an integral part of the communities we serve. We started the Give Where You Live program to help bring awareness to our nonprofit partners. We're more than just a local business bank. In fact, we're a full-service, independent commercial bank that is locally owned, community-minded, and relationship-driven. I'm Tamara Gurney, President and CEO of Mission Valley Bank, and I invite you to experience the Mission Valley Bank difference, where your success is our mission. We want to be your most valued bank.
Mission Valley Bank has been named Most Trusted Advisor Business Banker by the San Fernando Valley Business Journal 5 years in a row and received the Business Leadership Award by the Santa Clarita Valley Chamber of Commerce, Valley Industry Association, and SCV Economic Development Corporation. Visit them at their Center Point branch location or at missionvalleybank.com. Member FDIC.
At Advanced Audiology, we know how important hearing is to you, your loved ones, your work success, your safety, and your ability to stay in the game. Most people won't admit hearing loss to themselves or others. We make it easy for you. Today's digital hearing aids come in a variety of styles, including invisible. All feature-rich, providing unparalleled hearing quality, wearing comfort, and automation that simplifies your life. Don't be fooled by our imitators. There's only one Advanced Audiology with the purple sign next to AAA on Valencia Boulevard.
KHTS. Now FM 98.1 FM and AM 1220. Your hometown station.
Welcome back, folks. You are listening to Aging with Power, sponsored by Comfort Keepers in Home Care. I am still your host, Myles McNamara, and we are speaking all things UCLA Health today. And we've had some amazing specialty services, doctors in the house, and we are closing up with, but not least, Dr. Jacqueline Collins, who is new to the area, an obstetrician and gynecologist who's recently joined the UCLA Health team from the East Coast. Dr. Collins, welcome to Aging with Power.
Well, thank you for having me, Myles. I really
Absolutely.
enjoy being here.
Well, let's start out with the kinds of things and conditions that, give us kind of an overview of the obstetrician and gynecologist life and what the types of conditions that you basically look for and treat.
Sure, absolutely. So, being an OBGYN, I see a lot of different things. A lot of women come in and seek primary care through their OBGYN, which is one way I get to meet lots of people. I think the OB part's a little self-explanatory. I see pregnant ladies, which I love, okay? But with gynecology, you see everything from women going through menopause, trying to deal with hot flashes, mood swings, night sweats, that fun stuff. You get your routine pap smears and annual exams, but you also see a lot of pelvic pain, STD screening, contraception, the whole gamut of women's health needs.
And you pretty much through the entire age spectrum.
Mm-hmm.
You don't specialized on one area of the timeline there?
No, I've seen as early as about 12 up through 104.
Right.
Yeah.
And so as far as you mentioned menopause, do you get involved? Do you hand that off, or do you get involved in the hormone therapy? Do you? Where's that baton handed off, if at all?
Right. So I do get involved with hormone replacement therapy. I think that's certainly an important aspect of women's health, especially in the aging population. There's finding the right candidate, screening, then finding the right hormones for them, okay? Whether or not they want to be on oral hormones or transdermal, and for some patients one is better than the other. Whether or not they need to be on progesterone, if they have a uterus, to protect their uterus. So, often starts with a conversation. It starts with a consultation, seeing what their symptoms are, what their needs are, and then trying to kind of devise a plan.
And what is the major difference that you see that makes the patch better than the oral?
So the patch is, for a lot of patients, the patch is the way to go. For one thing, they don't have to remember to take something every day, which is nice. Although sometimes they have to take their progesterone to protect their uterus. But you have a patch, you put it on, you're good to go, okay? And also for a lot of patients, especially if they have some high cholesterol, those kinds of things, it's a better option for them. You see less spikes in triglycerides, especially when you're using the transdermal patch versus the oral. So.
And for a non-medical guy, what's the triglycerides?
No, it's your cholesterol. It's one of those bad cholesterols, not the good cholesterol.
Okay.
One of the bad cholesterols.
Okay, very cool. Mm-hmm. And so it's funny because we as I said earlier bounce around the timeline, but Aging with Power kind of focuses on seniors. But I read something the other day that seniors are very sexually active still.
They are.
So what are you seeing? I mean, they've got to worry about the same things that we talk to our kids about as far as, I guess safe sex, versus, has a different meaning for seniors because the childbearing days are over. But what are you seeing among our seniors as far as maybe some sexual issues as far as ED and such, but as far as sexually transmitted diseases, and what's that whole world looking like right now with the, advent of Viagra and Cialis and all these things that bring people back to the table, so to speak.
Mm-hmm. And, this is definitely a particular interest of mine. I feel like it's something that often tends to be overlooked. And I think it's a struggle for a lot of OBGYNs. I think, women, they have their babies or they go through that part of their life and they kind of forget about taking care of themselves and that aspect of things. And in reality, the CDC has noted that in the last decade or so, they've seen such a spike in STDs, but especially among our seniors. You still see it obviously in your teenage and your young 20s, but, the 50 to 90 is the next highest spike percentage-wise.
Don't refer to 50s as seniors. Stop it.
Well, I'm referring to women who don't have to worry about the pregnancy aspect.
Oh, okay, fine,
anymore.
all right.
Yes.
Okay.
So, and often they think, okay, well, I don't have to worry about getting pregnant. I don't have to worry about anything else.
Right.
So I'm not going to think about that. But, safe sex is very, very important. And, STDs, say you contract chlamydia, okay? Well, okay, you don't have to worry about the fertility aspect of it, but it can worsen any issues you have with chronic pain or, any other comorbidities or other, problems that you have. It can make them worse, and it is something you have to worry about and think about. So safe sex is just as important to talk to our seniors about as to talk to our teenagers
Got to sit
about.
grandma down and talk about the birds and the bees, huh?
You do. And the OBGYN is one place to do that.
Right.
I find a lot of my seniors, when they come in, they don't broach the subject. And, I make it a point. I make it an effort to talk about, are you sexually active? How is that going? Are there limitations? Do you find that you're not sexually active because of pain or because of a lack of lubrication? Those kinds of things. And I try to talk to my patients about that. Pretty aggressively.
So shifting back, kind of been the unofficial theme today, as far as early detection and proactive and stuff. What do you see on both sides of the timeline? Our teens and young adults, all the way up to our seniors. What are you seeing as the most, I guess, neglected part of their proactive OBGYN care, as far as screenings and visits, and nothing's wrong, but let's just stop on in and be proactive? What are you seeing on that?
Exactly. And I think that's the thing, is that people aren't being proactive. They don't come in, they don't seek care unless there's a problem. And so for your teenagers, a lot of times, they're really struggling with painful periods, the mood swings that come along with periods, especially in the first 10 or so years that you have your period. And then, in my older population, again, they only come in if there's problems. Postmenopausal bleeding, if you haven't had a period a year and then suddenly you start spotting, come see me. Please come see me, okay? Don't let that go for 6 months or a year, or wait till it happens again. Okay?
And
Those kinds of things we need to look into.
What do you see the primary reason for that if they start spotting after a year?
Well,
it's not the big C usually, is it? I mean,
no, a lot of times actually it's something called atrophy, which is like a thinning of the tissue.
Okay.
Your estrogen level goes down, you lose your lubrication, but you also lose some of the support of the tissue down there. It doesn't stretch, doesn't give as easily, it tears more. And so you see some of that tearing, and that results in bleeding and pain. And, a lot of times patients have that problem, and that's something I can help them with.
Cool. Well, be proactive, folks. And Dr. Collins is new to our coast, so go see her and make sure you're doing everything proactive. Dr. Collins, I appreciate you taking the time to come see us today.
Absolutely. Happy to be here.
All right, folks. We're going to take our last break, and when we come back, we are going to revisit Miss Nikki Bonner, who is going to kind of recap everything for us, talk about UCLA Health as a whole, remind you where the locations are, how to contact them, how to investigate if your insurance is valid through UCLA Health, and anything you may want to know. So don't forget, we are live Facebook. Submit a question if you'd like, but we will be right back. You are listening to Aging with Power on your hometown station, AM 1220 and 98.1 FM.
Satisfy your sweet tooth with a bite of sweet perfection from Nothing Bundt Cakes in Valencia. Their decadent cakes are ideal for your next birthday, anniversary, baby shower, wedding, holiday party, and more. Nothing Bundt Cakes makes their treats readily available without compromising quality. You can expect real butter and cream cheese, fresh eggs, and lots of love in each of their 10 luscious flavors. To order your own sweet treat, visit their Valencia Bakery in the Whole Foods Shopping Center or log on to nothingbundtcakes.com.
Hi, this is Kirk Stinson with Plumbing by Kirk, your hometown plumber. By this time, you should know where all your gas and water shutoff valves are in case of an emergency. If you don't, you should call Plumbing by Kirk. Our friendly staff will be more than happy to set an appointment for one of our technicians to come to your home and clearly mark all your shutoff valve locations. We invite you to visit our website for free plumbing advice at plumbingbykirk.com or give us a call, 263-6519. That's 263-6519.
My dad is the best plumber ever. Plumbing by Kirk.
You might not know the difference between a fade, a pompadour, a cropped fringe, or faux mohawk, but the Sport Clips Guy Smart stylists sure do. We know you don't think about haircuts 24/7. That's Sport Clips' job. That's why Sport Clips specializes in haircuts for men and boys. Sport Clips has turned something you have to do into something you want to do. You don't ever need an appointment at Sport Clips, and you'll walk out feeling like an MVP. Guaranteed. Sport Clips at the Santa Clarita location nearest you.
Hey there, it's Tori with your hometown station weather. Some showers expected this afternoon with a high of 61 degrees. Clouds overnight with a low of 48. Tomorrow, a mix of sun and clouds and a high of 67. Gilbertson and LaCornu Orthodontics is offering a Mother's Day Invisalign special Tuesday, May 8th. Save up to $500 off of comprehensive Invisalign treatment and get free teeth whitening for your best and brightest smile. Visit embraceyoursmile.com to schedule your free consultation.
Welcome back, folks. You are listening to Aging with Power, an information-packed show today on your hometown station, AM 1220 and FM 98.1. UCLA Health has shared a lot of their specialty services today, and so if you've missed any part of the show, you can catch it on podcast at hometownstation.com. If anything you've heard today you think someone else could benefit from, again, please have them check out hometownstation.com, listen to the podcast of this show and all the other shows that Aging with Power has done, and any other show that's happened right here on KHTS. So we are going to wrap it up today by circling back to Ms. Nikki Bonner, the Marketing and Community Outreach Coordinator, to touch upon a little bit of what she touched on at the beginning of the show and a lot more as we wrap this up to help get your information for UCLA Health in line and how it may benefit you. So again, Nikki, thank you for coordinating all these amazing doctors for me today. That was an amazing bunch of folk.
Well, thank you, Myles. We really appreciate the opportunity. I would like to just pass on the contact information for UCLA Health, particularly if anyone is interested in seeing any of the catching up with any of the folks that they heard today. We have our phone number is 1-800-UCLA-MD1. And that's a pretty easy number to remember, but I'll say it again, 1-800-UCLA-MD1. And that is the number to call for appointments. It's also the number to call for insurance information. This is something